Our core values are to fulfill UPMC Hamot's mission through commitment to these values:
quality, compassion, service,
respect, integrity, and cooperation.
At UPMC Hamot, our mission is to serve our patients, communities, and one another
in the UPMC Hamot tradition of quality,
health, healing, and education.
To put it simply, to serve.
To serve.
to serve,
To serve.
to serve, to serve.
I decided to become a nurse because when I was little, I had a nurse taking care of me who was really compassionate, and I really trusted her. And I knew when I grew up I wanted to be that person for someone else.
I was almost born with the natural need to care for others.
When I was a teenager, my father became quite ill and required a kidney transplant. I kind of got involved in the technology and the hospitals and those kind of things, and that was my original motivation.
I really had a calling because my daughter was sick and I wanted to give that care back to someone else.
My mom is a nurse, and when I went through nursing school, I just realized that it wasn't about me and how I felt, it was about how other people feel. And so to become a nurse, I wanted to impact other people in that way.
We've seen an incredible pace of change over the last 2 years here at UPMC Hamot. Nurses have led many of those changes. The Clinical Decision Unit is an excellent example. Patients present to our emergency room. Their diagnosis is unclear as to whether or not they warrant inpatient care. Our nurses went from concept to execution in 30 days and created a unit that allows us focused diagnostics, expedited care, and timely disposition to either inpatient or discharge to home with follow-up care.
Certainly there were little steps here and there that had to be fine-tuned after the fact, but it was a very, very busy 4 weeks with lots and lots of support and help from other members of this hospital to make this happen. The biggest thing as far as the CDU being able to benefit patients and family is really about getting them back to their lives in the quickest manner possible. There's certainly a lot of changes that we see in the insurance world, and I'm sure we're going to continue to see, and Hamot has taken a very active step to make sure that we are meeting the needs of our clientele. They have very good resources as far as the nursing staff. Again, I think they have wonderful nurses up there who really do a lot of education with them. They make follow-up phone calls to make sure that they're going to their appointments and things like that. And I think that those are all things that benefit patients and families.
The real testament to the success of the CDU is the 20% reduction in length of stay for these observation patients. Our nurses were pivotal to this success.
Nursing is what I do. I love what I do, and I think it reflects everywhere I go.
It's really rewarding. I wouldn't imagine myself doing anything else. I wouldn't want myself doing anything else. This is what I love, and this is what I want to do.
As a youth, I'm not sure I could articulate that I wanted to be a formal nurse. At the same time, I never considered any other profession.
It's not a 9-to-5 job or a 7 to 3:30 job. It's what you are, it's what we do.
Every day it's affected my life. I go home and remind my family how lucky we are. And every day when I come to work, it just makes me feel very fulfilled.
I once heard someone say, you find a job you love, you never work a day in your life. And to me, that's very applicable because I don't feel like I work. I feel like I have a pure love, a calling for nursing, and I really enjoy it.
Being a nurse has affected me in so many ways in that it has become sort of a spiritual journey. How I realize that we are all so connected. The little thing that I say to a patient or do to a patient has such a significant impact that sometimes we're not conscious of it. But it's how you touch or turn a patient or hold their arm that, for me, it just completes my whole spiritual outlook to life. And it completes me as a human being too.
Before I used to work a lot more extra hours, so it just helped with, books for that semester. It helped with getting to and from school. It was just a nice little cushion to be able to kind of rely on and really helps defray some of the cost with continuing my education. It just all started when I decided to do it. Everything just kind of fell into place that was going to be what I was going to commit to for the next, 3 years. And now with only 1 year to go, I finally see, my goals being reached, and it's a great feeling.
I started wondering, I'm going to miss his birth. It's, why is this happening today? And the nurse was like, we're not going to let that happen. We'll figure something out. The only thing I could think of was that I wasn't going to make it. And that was a horrible feeling. But the way the nurses reacted and went out on a limb, and above and beyond to make that special day unforgettable. Definitely unforgettable. For what she did is, well, forever be in debt for that. Always. Always.
Yeah. Definitely won't be able to ever repay her for doing that for him or me and us.
Just above and beyond. That's all I have to say about all of it.
Everybody.
Amazing.
Everybody.
The best part of my job is meeting all the various patients.
The best part of my job is definitely patients.
The best part about my job would be the patients.
Taking care of the patients is the best part.
The best part about my job is when you see a patient who came here not able to breathe or walk. They are getting up after that second day, the day after being an inpatient. They're able to walk, they give you that hug and say, thank you, honey, for everything you've done for me. I mean, that's priceless for me.